Good morning.
Good morning.
How you doing this morning?
All right, I'm a little sore.
I'm Kim Clemens. I'm going to be your nurse today. Can you tell me your name?
My name's Raul Rose.
Okay, and I'm just going to look at your bracelet here, and that way I know you're not lying to me. How you feeling?
Like I said, I'm pretty sore.
Really? Have you been up out of bed at all?
No, not yet.
Not yet. Well, physical therapy will probably come around a little bit later today and get you up. So we'll get you something for pain, get that on board before they get you up.
He's real
Okay.
excited about that.
Yeah. That's the best way to get that soreness out, is to get up and get moving. I'm going to go ahead and do your physical assessment right now. It means I'm just going to kind of look at you from head to toe, make sure everything's doing okay. Is that okay to go ahead and do right now?
Yeah, go ahead.
Okay. Well, first of all, who have you got here with you?
Oh, this is my wife, Kristen.
Okay, nice to meet you.
Nice to meet you too.
Can you tell me a little bit about what was going on with your knee before you came?
Oh, I had an old injury, and it just got worse and worse and worse, and got to the point where there really wasn't anything they could do for it. You know, it was a good candidate for knee surgery or actually knee replacement. So just said, let's go ahead and do it. I got tired of taking medication that wasn't working.
Yeah. Did it hurt all the time?
Yeah, pretty much. Pretty much, yeah.
Should have went to the doctor a long time ago when I told him to, but
You just,
he's stubborn, you know.
yeah, you just have to come to that realization yourself.
Yeah.
And sometimes it takes people a little longer, and that's okay. I'm gonna look in your eyes here first, so I'm gonna shine a little bright light if you'll just look straight ahead. Okay. Okay. And if you'll look at this, and then I'm gonna move it and just change your focus on it when I do that. Okay. All right. And if you could open your mouth, and we'll just look in there. Okay. Well, everything looks good.
What
Are-
were you doing?
Well, I was just checking the nerves, make sure they were working and that they make that little dark spot in your eye close up.
Okay.
Everything looks good. Are you eating okay?
No.
No, I'm a little nauseous.
Okay. Okay. Have you thrown up at all?
No, but just that nausea just doesn't really give me much of an appetite.
Okay. Okay. Well, now you have something ordered for nausea, so all you have to do is ask for it.
Maybe a little later.
Okay, okay, well, we can do that. I'm also, let me just, I gotta pinch you here just a little bit. This is just to check the skin turgor. Make
What's
sure.
that?
That just
Skin
makes sure
turgor?
they've got plenty of fluid. We don't want
Okay.
people getting too dehydrated while they're in the hospital. He's got this IV fluid running, so that shouldn't happen.
Okay.
But that helps us just check that. Okay. And I also gonna listen to your heart and your lungs. So I'm just gonna, if you don't mind, I'm gonna
No.
slide this gown on down so I can get to you. And we'll just kind of lay it here, not worry about your IV. First, I'm just gonna listen to your heart, so you can just breathe normally. Okay, everything sounds good there. Now I'm going to listen to your lungs, so if you'll take a deep breath through your mouth every time I move the stethoscope, that'll help out. Okay, that sounds good. I also need to listen to the back. Can you sit up? Okay, we can help you. Okay, now just the same thing again. If you'll just take a deep breath every time I move the stethoscope. Okay, Just lay back down here and just take your time.
Oh,
Okay.
Now, how come you listen to his heart for so long? Is
Well,
everything okay?
You need to listen to it for a full minute. We count it for a full minute.
Okay.
So there wasn't anything wrong. I just listened to it
Okay.
for a full minute. And then we listen to see, sometimes after surgery, you get a little fluid trapped in your lungs, and we can hear that. So that's what we're listening for. Did they give you some kind of little machine for you to take some deep breaths? Do you remember
Yeah, I
that?
took that home.
Okay, you need that here. So if you could bring that
Okay.
back.
All right.
We want you to take deep breaths at least every 2 hours. So just use that machine, see how high you can get it up. That helps expand your lungs really wide and keeps that fluid from getting trapped in there.
just blow into it?
You suck in like you would a straw. You know how you suck in with a
okay.
drink?
I guess
So
I've
you're
been
going to
doing
take
it.
that, yeah. You're going
No
to
wonder
take
those
that.
little things wouldn't go up.
Yeah,
Okay.
that's why. So bring it back, and I'll watch you do it, and be sure you got it right this time. Okay. And until then, if you can just take some really deep breaths, like take 2 or 3, and then on the last one, take a good deep cough. So try that.
Ow.
Okay.
Ow.
Okay. A little painful, but it'll get better as you keep going, but that keeps you from getting pneumonia.
Well, it just moving
Yeah.
the whole leg.
Yeah.
Just,
Okay. I'm going to listen to your tummy now.
okay. Yeah.
Okay, that just lets us know everything's moving around in there like it should. When was your last bowel movement? Do you remember?
Day of surgery, morning of.
Okay. How often do you normally go?
Pretty regular, about once a day.
Okay. Well, sometimes some of this pain medication we give you kind of slows things down, and it might not be moving through there as well. So if you feel like you haven't gone and you need to go, then you might want to ask for a laxative. You've got one of those ordered.
Okay.
Okay. And I'm just going to kind of mash on here just to see if you're tender at all. Any tenderness in there? Good. Okay. All right. Well, we can slide this gown back up on you. There we go. I'm going to look at your hands here. Okay. I'm going to just feel your pulses in your arm. Okay. And if you would, if you'll take a hold of my fingers here and just kind of squeeze just tight. Okay, that's good. We're just checking your grips there. Make sure you're still strong. You got to be able to hold that walker when you start walking. So we want you to have some good, strong grips. Are you emptying your bladder okay?
Yeah, it's okay.
Okay.
It's not-
Kind of
You're
hard
going.
when you're not getting up.
Yeah, and that'll probably get better when you start moving around a little bit better, but as long as you're going. Okay. Now, I'm going to look at your legs here, so I'm just going to pull the covers down. Make sure you're covered up there. Okay. Now, I'll check your pulses here. Okay. Can you move around this foot? Okay, and pull it way back towards you. Any pain in here at all when you do that? Okay, good. Let me just check your capillary refill here on your toes too. Okay. I'm going to look at the other one here.
You need me to move?
No, you're good. You're
Okay.
I'm okay.
All right.
Okay.
Does everything feel okay
Mhm.
on that side?
Got good
Okay.
strong pulses here, so he's getting good blood flow, and
Good,
that's what we
okay.
want. That's certainly very good. Everything looks good. His feet are warm.
Good.
They get real
Okay.
cool. Sometimes that means blood's not getting all the way there.
I
Doesn't
was
look.
worried that might be too tight, but you think it's okay?
Yeah, I think it's okay because
Okay.
we're getting good pulse down here. Everything's good. No bleeding on here, so that's good. Can you wiggle? I know this one hurts a lot more. Can you wiggle this around a little bit? Yeah. Okay. Can you pull your foot back at all?
That just hurts my knee.
Yeah. But I'm also looking at your calves here. People can get blood clots if they stay in the bed a long time. We don't want that to happen to you. So I'm looking at your legs, see if there's any swelling or redness, and I don't see any of that.
Okay, good.
So it looks good right now, but that's one of the reasons why we need you to get up out of bed. And physical, like I say, physical therapy is going to come and help work with you on that. Okay. Now, you got some pain here, I know. Can you rate it on a scale of 1 to 10?
It's pushing about a 7.
Okay.
I'm thinking pain medication.
Okay. Is the pain medication, has that been helping when we give it to you?
Yeah, it helps.
Okay.
It helps. Takes the edge off.
Well, that's good. That's good. And like I say, even though it's going to hurt getting up with physical therapy, that's going to be the best thing. It's going to start getting less and less each time you get up. But let me get you something for pain right now. Let that work, and then we'll get physical therapy in here to get you up.
Are
Any-
you hungry?
Yeah, I'm kind of hungry.
Will you want me to go get you something to eat since you don't like cafeteria food? And I'll go home and get that machine.
Yeah, give me some like sausage biscuit or something.
Well, what do you think? I don't
That'd
know.
be fine.
Sausage
Just
biscuit will be
anything you'll
okay.
eat. Anything you'll
Okay.
eat. Do you need something for nausea before you take that?
Yeah.
Okay. Well, I'll get that for you.
And I'll
then
I'll run home real
that'll
quick.
be
You need
working.
anything else from the house?
It's magazines.
Okay. You got a new one yesterday, so I'll bring it in. Okay.
Okay, well, and you know where the call bell is. If you need the nurse, you just hit that call bell and I'll come in, okay?
Okay.
All right.
Thank you.
Thank you.
You're welcome.